Hello, I'm Joan Justice with HealthWorks Collective, and I'm here today with Donato Tremuto, CEO and Vice Chairman of Physicians Interactive and the founder of Health eVillages. Health eVillages, a program of the not-for-profit Robert F. Kennedy Center for Justice and Human Rights and Physicians Interactive, provides state-of-the-art mobile health technology to medical professionals in challenging clinical environments around the world. Physicians Interactive just announced a partnership with Tesh Action Board, and through the help of Health eVillages will start providing help to healthcare professionals in southern rural Louisiana, an area heavily affected by the BP oil spill. Donato, please tell us a little bit about the partnership and how Health eVillages is going to help improve the quality of care in Louisiana.
Well, thank you very much, Joan. I'm very pleased to talk about this partnership in particular because I think it's touched the hearts of the world. The Tesh Action Clinic is a community that's about 2 miles west of New Orleans. It's about 8,000 people, a very poor community. 27.6% of that population is below the poverty line. And so they depend on employees coming in from the city. They depend on a lot of support. And with the RFK Center, that center has been very, very active in terms of being the ambassador to move forward the creation, if you will, of programs to address some of these healthcare needs. We, as you know, are in partnership with the RFK Center. And so it became very, very clear to us that there was a real opportunity to partner with that clinic. Basically what it is, we're taking our devices, our mobile units. The uniqueness is not just the devices, it's the fact that we preload them with information that is specific to the needs in that community. And it is clear to anyone who visits that community that these toxic chemicals have in fact created dermatological issues. And so we preloaded these devices with issues that are most specific to skin diseases. There will be an opportunity for us to collect data, understand what those issues are, and certainly moving forward, improve the healthcare state in that community. So we really are excited. It's not just about a partnership with the RFK Center for Justice and Human Rights. It's about really advancing what we think are important variables to improve health.
Okay, great. How are the healthcare professionals coping now in this area?
Well, I think it's like any other community in the United States. Physicians, there are a few physicians. Patients now, with the result of the Gulf oil spill, have many more diseases. They're visiting the clinics, and so there's an overload feeling. And so we hope that these devices, my whole theory as a founder of Physicians Interactive has always been, can these mobile units give physicians the power and the time back to see more patients?
Yeah, great.
And that's what one of the derivatives of this program is, to help physicians, give them tools that can help to expedite their ability to see more patients.
Yeah, wonderful. So these will be used by healthcare professionals, meaning doctors and nurses, nurse practitioners.
You got it. You got it. It's a healthcare professional, physicians interactive, physicians assistants and nurse practitioners. It's all that group that will have the access to these devices.
Is this part of a study?
Very interesting question. We have now 7 pilots that are active with Health eVillages. I like to say this is a demonstration project, that the ability to collect the data will in fact create for us the antecedents of what that next program might look like. And we envision in the next 2 years that we will narrow the focus of Health eVillages so that we have, if you will, the kind of data that will qualify what offerings can we really bring to communities. And so, yes, in many respects, this is addressing a need, but it is a demonstration study as well.
Okay, great. Now, how many people do you expect to be in this project? How many healthcare professionals and how many patients approximately?
Yeah, I would say that there's going to be about 10 healthcare professionals. We will expand the program, obviously, in the future. And I think you're talking, easily this could have anywhere between a couple thousand and 4,000 to 5,000 patients.
Wow, that's a lot.
It's a community of 8,500. Not all of them are going to be, in the clinic, but I would say that you're looking clearly at 30–40% of that population.
Okay, wonderful. And what will this hopefully accomplish? I guess saving surgeons or doctors time and helping them help their patients.
Well, I hope it's also going to save lives. We have documentation of how these devices have actually saved lives. That, you know, I got into this because 35 years ago, my sister-in-law went into the hospital to deliver her second child, and she died. Oh. They gave her the wrong medication, and it was a visiting physician that evening. And so my passion is that we could save lives and improve the quality and get the information into the hands of the clinician at the time when they need it. We will advance the quality, in every single citizen in the world deserves that kind of health care. They deserve and they should have the right to go into a healthcare clinic with every assurance that the information that the physician needs or the healthcare professional needs is accessible and there. And that's what this program will do.
Right there, yes. Mobile Health gives it to them right there in their hand. That's wonderful. And how many countries are you in now, Donato?
We are in China, we're in Haiti, we're in Africa. We are obviously now here in the U.S. We continue to expand in Kenya and Uchuma. I mean, there are many villages. I don't like to look at these as countries, but more, you know, where are the opportunities in these villages? Because these villages in themselves become a country. They're different. They're, you know, different leadership and, you know, different politics. So right now, the 7 pilots are in a number of countries, but certainly more villages than countries.
That's great. Thank you so much for this, Donato. Thank you so much for joining us and letting us know about this great partnership. And thanks for all the good work Health eVillages is doing.
Oh, well, thank you. And I want to thank the RFK Center for the great work that they've done in partnering with us.
Great. Thanks a lot.
Thank you.